Hey everyone, Otis Toussaint here for Lead TV. We've got an awesome opportunity today to talk to one of our more talented Army nurses, Lieutenant Colonel Wissemann. He is going to be joining me today to just basically talk about how Army medicine and how, I guess, the work that we put in globally and how does it support the democratic efforts that we push forward in the U.S. government. So we're going to talk essentially about the global health engagement. So I hope that you enjoyed today's discussion. And so here we go. And without further ado, I'd like to introduce you to Lieutenant Colonel Wissemann.
Hey,
what's going on, sir? Did I pronounce your name correctly?
Yeah, you got it. I think throughout my Army career, I've been called a lot worse. So, Wissemann pretty spot on. So,
okay,
I wanted to wish you a quick happy birthday. Right? I understand you were a 101st soldier a while ago.
Oh yes. Fort Campbell, Kentucky. Just fun times. Yeah. Back in 2010, it was my first duty station. And then I switched over to the 86 Cash. So yeah, I had a good time over there in the 101st, Clarksville, Kentucky, Clarksville, Tennessee, and of course, Kentucky right there. We were right at the border anyways. And we had a great time when we were there. So thank you for the 101st shout out there.
Yeah, absolutely.
I understand, can you tell me a little bit about, what you do, what's your Army background and everything as such?
Sure. You mentioned the 86 Combat Support Hospital. I did, I asked for my first deployment as a brand new nurse, and they shifted me over to the 86 Cash. I got to do JRTC with them in 2001. Mm-hmm. Then we went over to Kosovo for 0102. Mm-hmm. Then we came back and we refit, resupplied, and we were on the ground in Kuwait in January and crossed the border with the 86 Cash into Iraq in March of 03. Set up the first Role 2 plus Role 3 facility, mm-hmm. Just outside Al Nasiriyah, LSA Adder at the time. I've enjoyed my time overseas and working with different facilities. From there, I went off to Landstuhl for a while. I did chief hospital education over there, as well as a company command and some PACU mm-hmm. time. Went to Baylor, got my master's in healthcare admin. Did some head nurse time at Madigan, went back there again. Great area, Pacific Northwest. And then went off from the Pacific Northwest, went off to Kansas for a year for ILE, and then New Mexico, right? Who knew we had a base in New Mexico? But White Sands Missile Range, about an hour and a half north of El Paso.
Nice.
And then, I went up to OTSG, did a year up there and did some time in Fort Belvoir. And while I was at Belvoir, another tour with the 86 Cash, final farewell tour. And that was 17-18 to Kuwait. And then they came back and they changed from the 86 Cash to what we know now as the 531st Hospital Center. Mm-hmm. And then I PCS from DC out to there, and that's where I've been hanging my hat now. Just finished the tour at Blanchfield for 2 years as the Chief of Inpatient Services. But I understand you may be head to DC too shortly. We'll see, huh?
Well, we will see. We will see. We haven't put it out there as yet, so we'll hold off on announcing that way too soon. But I appreciate the acknowledgement of the things that are coming up in my career, and of course you sharing with us a little bit of your career. We were talking to each other before we actually went live, and I saw the wonderful German license plate in the back of you, and you kind of gave me some good memories of my time in Germany. And it's wonderful the opportunities that the Army gives to you to travel, to serve in various places, various spots, get a chance to essentially go global. And so I guess a big thing that I'd like to talk to you about, essentially what our discussion is really all about, is what exactly is this global health engagement? Can you talk to us what that's all about?
Yeah, absolutely. Global health engagement is really bottom line. You know what? Can you throw up that first slide, Otis?
Okay, that's too easy. Let's pop that up.
There we go. All right. So right now we're looking at President Barack Obama, right? And he's got the president of Israel there. It's 2013. You see these two guys. They're engaged with each other right there at ease, like you and me right now, right? We're smiling, having a good time, relaxed. They're forming a bond. They're forming a connection. And really, that's diplomacy, right? That's what we're looking at. We're looking at that great, skilled diplomat right there, interacting with another head of state. Next slide.
Okay, that's too easy. Oh, let me do a quick history guess. Is that Boutros Ghali?
No. That's President Sharon Perez.
Oh, okay. Well, then I was way off. My bad.
No, that's okay. But this is diplomacy too, right? This is global health engagement right here. And we're looking at Captain Young, and I would tell Captain Young she's probably on her cell phone, probably for a good reason, right? But overall, you see a group here, and they're getting together, they're exchanging ideas. You can see that bonding going on, that learning. You got the sergeant leaning in on the background; he's probably picking up some stuff too, and everyone's interacting, and they're forming these relationships, right? Which is essential when we talk about global health engagement. Talking about building relationships with other countries. We're trying to influence them. The same way China's using health as well, and they've been using that for the better part of the last half century to try to influence Africa. But global health engagement is really it was a term defined during the Carter administration that using health we can open doors for more diplomatic cooperation, more military cooperation, all those different things.
Okay, let me do this before we go further into the future slides. Let me go ahead and say how we're going to set up this discussion, sir, is I'm going to give you the full screen. And if I see something there, or if there's a point that you'd like to share, or if there's a comment on our screen, we'll pull it up and we'll talk about it. Is that fine with you?
Sounds great.
Okay, so let's maximize the screen. Here we go. Go ahead, sir.
So as we talk about global health engagement, we're really talking about the U.S. government engaging with other countries. We happen to be, part of that arm with global health engagement. But it's not just the U.S. government. Bill and Melinda Gates, I think in 2018, they donated $1.8 and change billion. That's with a B, not with an M. That's not a typo. $1.8 billion in global health and trying to help out different countries around the world get after health. It's a global health engagement is done by the State Department. They've got a great program called PEPFAR, which is the President's Emergency Plan for AIDS Relief, and really focused on Africa. They've got the military does some great programs we can talk about a little bit later when we talk about whether it be medical assistance programs or subject matter expert exchanges. And again, we're building those relationships so that if we needed to go here or there somewhere in the future, or we need to cooperate with another nation, we've got some of those foundations. We've got some of those building blocks that we can reach out. We can pick up the phone, speak to someone, send an email. So those are all important things. So
you're saying that private citizens can donate money. Of course, if they're wealthy private citizens, they could donate money to assist with this global health initiative that we essentially are trying to outsource to different nations from the U.S. is what you're saying.
On the civilian side, there's plenty of organizations that really get after global health engagement. And full disclosure, I'm not part of any of them, but a few of them that have come up in my research were Project Hope. And we can talk a little bit about that and their efforts with the USNS Mercy and Comfort, which are two hospital ships we'll talk about a little bit later. Okay. But Project Rubicon does a lot of global health engagement. That's usually a pretty strong veteran organization for looking at those bonds afterwards too. Then, of course, the philanthropic organizations such as the Bill and Melinda Gates Foundation. Those are all some really great organizations.
Excellent.
Yep.
Excellent. All right. Do you want to jump into the next slide?
Sure, we could jump in there.
Okay.
So this is a great example of doing some work in Southeast Asia. We've got a sailor on the left side, I believe, there, and he's engaging with one of the local citizens. And you see in the background, we're looking at glasses, right? Eyeglasses. And we're like, oh, he's handing out eyeglasses, right? Something we take for granted over here, contact lens, glasses, even, having surgery. But you can see how excited mom is in the background. And it's something, I don't want to oversimplify it, but it's something that's easy for us to do, right? And we take a look in some of these countries, this kid, if he can't read, right? If he can't see, he can't read. And if he can't read, his outlook for life is probably not as optimistic as it would be as if he could see and read. So just handing out glasses is something simple, and mom gets it. Mom understands it. Kid's just having a good time, right? He can see now. Everything's not a blur, and who knows? Maybe that's the next prime minister or the next president. Well, probably not the next, right? He's probably got a few decades to go.
Yeah.
But he may be a future prime minister or a future president, and he may understand, or have that affinity for the U.S. afterwards. So still, trying to help the world over may have some other, long-term effects as well.
It's interesting. You're kind of winning hearts and minds here. This picture reminds me of, so I was a prior combat medic back in Iraq in 2003. And I remember when we were at the border of Iraq and Iran, and there was a place that we landed, and there were tons of kids there that were, yearning and searching for, a means of comfort. And I remember me being the medic there, a lot of the kids, some of them were not necessarily even hurt or anything like that, but they were looking, hey, American, Mister. And I remember having a bag of candy and handing out these pieces of candy. And these kids, they lessened their anxiety. They were more trusting of us. They were smiling. They were happier. I mean, the ones that didn't need the medical care, we provided the medical care. But the ones who just needed a handout to really, say hi and communicate with that soldier, we did it. And we had a great time doing that. It won the hearts and minds and actually assisted long-term in our mission over there. So this picture kind of resonates with me a little bit, me being the medic and, of course, the child and the parent there.
Yes, those Jolly Ranchers that win the hearts and minds.
Yes, sir. Yes, sir. Absolutely. Absolutely. Wow. So you just gave me a good go ahead, sir.
No, I was going to say, and engaging like this, right, in these countries, sometimes we go into countries that, would be classified, having just come out of the Army War College, I guess I should give the audience some background, did a lot of research on global health engagement, wrote a 5,000-word paper, and was fortunate enough to get recognized by the U.S. Army War College Foundation. But tying some of that global and strategic processes together, violent extremist organizations really exploit, those fragile states where maybe there's not a strong government, right? So if we can come in and we can stabilize that a little bit with a little bit of solid healthcare, right?
Yes.
So many of us these days, a lot of conversations go about. We talk about health when we talk about healthcare as a human right to a certain extent, and if we can stabilize that, if we can provide that, then that's one less thing they have to worry about. Sometimes people don't know when their next meal's coming, whether they're gonna have a roof over their heads.
Yep.
So,
Yep. If you just take care of the healthcare for a lot of people, they don't necessarily, as you said, they don't necessarily know when their next meal is coming. But if you could put clothes on someone's back, put a roof over their head, and take care of their health, those basic needs, if you take care of a person's basic needs, they will be there and they will have loyalty to you in the long run. And that's definitely something that resonates with me personally. So I celebrate this picture, and I thank you that you sent this over. Do you want to jump into the next one, sir?
Sure, we can keep rolling on.
All right, let's full screen it and let's jump into the next one. So here we go.
So as we talk about global health engagement, we're talking about different activities worldwide, right? And before we really dig into MedCaps, as we talk about tying this to national security, well, what's so important about global health engagement? Well, there's a lot of national security underpinnings to global health engagement. The National Defense Strategy from 2017, the main pillar in there, pillar number 4, talks about advancing American influence abroad. And notice you talked about that, whether it's handing out Jolly Ranchers, whether maybe it's solving a quick cleft palate surgery for someone overseas, or engaging with others so we can bolster their healthcare system. That's important. Additionally, President Obama, when he was in office, he put in place President Executive Order 13747, and that talked about a global health engagement, and that really fostered a whole of government approach, whether it be USAID and the State Department, whether it be the military, other organizations, Transcom, and then of course, a lot of this goes to, strategically deterring revisionist states, as we talk about China and Russia coming up on the world stage, China, again, sort of taking a pretty, while they're utilizing soft power in the form of global health engagement, they've been doing that for quite some time. I think people are starting to see through their efforts. You know, they've used debt trap financing across the world to try to open ports and acquire ports and overseas basing locations potentially. The U.S. really doesn't go after global health for that. It's more of a influence and a diplomacy effort, truly. And this is a great example of that. So global health engagement, and we're talking about MedCAPs, which is Medical Civilian Assistance Aid Programs. This one's from the Comforts rotation last summer. They were out at sea for about 5 months. And while, there's some great statistics up there, I really don't
you said comfort. You said comfort. Can you clarify to the viewers who may not be military what exactly you mean by comfort?
Oh, sure. Thanks. The military maintains 2 hospital ships, the U.S. military. One's based on the East Coast, and that's the USNS Comfort. And then on the West Coast, we've got the USNS Mercy, based out of the San Diego area. And both these, as a matter of fact, very recently, within the last 6 months, have been
COVID.
Yeah, the Mercy rolled right up to Los Angeles, parked in the dock there, and started working to take care of patients. The Comfort went up to New York, saw a few patients there, and helped with some efforts, just even stateside, not even really globally, but stateside. And then as we take a look at this deployment for the Comfort last year for the 5 months, they gave away 30,000 eyeglasses. They did 26,000 eye exams, dental procedures. You see there 9,500 of those. They did 1,200 surgeries, had 31,000 family medicine practices. So each one of those is a separate and distinct engagement that allows us to interact with others. It also allows us, you can see all those different country flags up there. As we go around the Caribbean, it allows us to help build relationships. So let's say St. Thomas, St. Croix, or something like that, or Haiti, where we experience another global catastrophe like an earthquake or a hurricane or something like that. But we've already established those connections so that when we need to come in and help bolster the host nation, when they're in a crisis mode, it's not trying to learn those relationships. It's having those relationships that we can fall back on.
Absolutely.
Yeah, so it's very, very important. These are the MedCAPs is really something. As we talk a little bit later about things we could do better, this is something we've been doing better the last 15 years. I'd say when I initially went to Kosovo back in 2001, we came in and we really supplanted the healthcare system. We go out to villages and inadvertently we were stepping on toes, from time to time where there may be a physician, but we didn't incorporate them. Likewise, as we do these rotations now with the USNS Comfort or the Mercy, those 2 hospital ships, as we pull into port, it's incumbent upon us to sync our efforts with those non-governmental organizations or those international government organizations that may be there, with UN efforts, with private citizen efforts, as well as host nation efforts, because at some point that ship is going to pull out of harbor. Yeah. And we don't want everyone depending on the U.S. We want them depending on a better situated healthcare system that can take care of them a little bit more robustly than they did before.
So we essentially kind of improve on the infrastructure, the medical infrastructure that's there.
That's a great way of saying it. That's exactly what we're aiming to do.
Excellent. This excellent point. I see a lot of numbers here. People need to really be aware just how much of an influence and how much of a positive influence that U.S. medical professionals can provide to all these different countries and societies and nations. You see the numbers there. You see all the different interactions. You see the examinations, the number of glasses that we give away, the number of medical exams that are done, the amount of mail that's done. Heck, even some of the cargo that's sent out by, I see some of the helicopters there. You see the multiple nations there. I got excited personally when I saw Trinidad and Tobago in the top right hand. This is absolutely something that's wonderful. And it's something that, we should relish, something that, kind of plants the seed for future relationships. And I celebrate that as both as a native-born Caribbean guy and as a veteran of the U.S. Army. So shout out to all of that. Sir, you want to jump into the next slide?
Sure.
All right, here we go.
So as we talk about MedCaps, these are sort of the areas we would look to execute those MedCaps in, right? We're looking at a big open area there, maybe a coastal town, looks like potentially a second, third world country, and we've got a great building right there in the middle that looks like it's the central community building for a great location to set up potentially, right? So,
what country was this, by the way?
This was Indonesia. So, if you can take a look at the next slide, if you would, Oz.
And brace yourself, people.
And that's the same picture right after the Boxer Day, tsunami that occurred back in 2004.
So let me do some side by side so that people could see exactly what we're looking at right now. So this is before, and this is after. Do you all remember the tsunami that happened? What year was it? Back in 2004. Yep. There you go. So before and after. Okay, go ahead, sir.
And as you can see, the devastation is total, right? I think it was the earthquake was over 7.0. There was over, if I remember correctly, it was 15,000 times more powerful than the Hiroshima blast.
Yep.
There was 3 sets of waves that came ashore, roughly about 100 feet each. So you could just imagine the devastation,
terror.
Right?
Absolute terror.
Right. Roughly 300,000 dead, if I recall, and just everything completely devastated. So this is where, as we talk about areas for cooperation versus competition, global health engagement's got a few areas for cooperation. And one of them is HADR, what we call humanitarian assistance disaster relief. And this is a great example of an opportunity to come into Indonesia, which at that time did not have a really high opinion of the U.S. It was okay overall, but coming into this area, this was an opportunity to change that opinion. So coming in, you mentioned even the flight hours on the earlier slide. We were able to take people from land, bring them out to the hospital ship because the USNS Mercy came in. It set sail shortly after the earthquake from San Diego. It did not have its full complement of medical personnel. What happened was they flew a lot of medical personnel from San Diego to Hawaii, where they picked up supplies. They picked up some personnel at that point as well. There was civilians that joined as well because it was a joint effort with Project Hope. So we had civilians on the USNS Mercy providing care side by side with military medical personnel who just days before were working in Balboa Medical Center, Naval Medical Center out in San Diego. So they brought all that real world experience to this area very quickly. And sorry, go ahead, Oz.
Go ahead, sir.
No, they stayed on station for some time, provided a lot of HADR. And this part of the world, it was, if you've just lost everything and you've been living in this area for some time, and you've probably never seen a helicopter, and all of a sudden someone comes in with a helicopter and wants to take you out to this huge ship, which is just a mile offshore that you've never seen something that big, that close. It's intimidating. But we've got that opportunity to help foster those relationships and to try to decrease that anxiety. And that was something we really did, I think, a good job of getting after an effort in order to provide that continuum of care to people when they needed it.
Oh, wow. So what I was going to point out is, of course, I'm I actually work for medical recruiting as well. And so I do know a number of the presentations that I've given, we always speak about the humanitarian opportunities that you may have coming in as a medical professional. So say you come in as an Army nurse, you say you're an emergency physician right now, and you want to join the military as an emergency physician. You may have opportunities to actually come in and actually get these humanitarian opportunities of work. So, obviously, absolute devastation that happened here in Indonesia back in 2004, the opportunities to not only get lost in serving your fellow man or woman, but also an opportunity to, tell the story of what the Army can provide. Live that dream that you may have wanted that opportunity to have. These are all opportunities for you. So I just kind of diverted a little bit to my official job, but let's get back to the podcast a little bit.
Oh, that's fine. No, you're absolutely right. And I'll tell you, I started as a first responder. I took an EMT class, and I revealed to you a little bit earlier. I was originally going to school for poli-sci, and sort of went over to nursing because it wound up to a certain extent being a love of what I was doing. Right, as an EMT, I was going into people's homes when they were most vulnerable, when they needed help, and being able to be there for them, being that shoulder. And that's the great part about HADR and about global health engagement, about being there when a country needs you or when another human being needs you, right?
Absolutely.
So, sure.
Wow.
You want to take a look at the next slide?
Yeah, let's jump into the next one. I'll go ahead and go full screen, and let's jump into the next one.
So that was 2004 before. This is 2005, right? So immediately following that was the earthquake in Pakistan. And if we put it in context, in 2005, Pakistan was the way into Afghanistan. So all the supplies that were coming into country to support the efforts across Afghanistan were coming in through Pakistan. And there was some contention there, and the 212th Combat, at the time they were the 212th MASH, Mobile Army Support Hospital, and they were the last MASH standing. That's what we used to refer to them as. And they were getting ready to convert to a combat support hospital, again, a field hospital, very similar. But they packed everything up from Germany. They took it all to Pakistan, and they set it up there. So they wound up setting up a field hospital right after that earthquake, and they were providing some excellent care. There was a Marine unit as well, logistics unit, I believe, that co-located with them, and they came in. But as you can see there, this is a typical field hospital. This is what we're looking at if, as you mentioned earlier, if someone wants to sign up and go do HADR care, do some health engagement overseas, you can see a ProPac down there, vital signs monitor. And again, this is about 15 years ago. You got your big M cylinder of oxygen right there in the foreground, that green and white canister, because we have no piped in oxygen. You've got some supplies behind that and a chest up there on the wall. And that bed, if you're on it too long and you can't move around, well, there is no real big, thick mattress. It gets a little uncomfortable. This guy's got a chest tube, and he's doing a lot better now than he was then. But as you can see, there's a plethora of supplies around there. So those are all things we sort of get after with global health engagement and humanitarian assistance and disaster relief. Excellent. When the 212th left, as a matter of fact, the real cherry on top is that they left this hospital for the Pakistanis. So they left this and all the equipment. They were getting ready to undergo that conversion from a MASH to cash anyways.
Yes.
So they left this in place, and instead of bringing it back and using it as sleep tents, they left it to give the Pakistanis an additional capability. So strategically, obviously, I'm sure this affected to a certain extent the calculus between the U.S. government and the Pakistani government, trying to keep those borders open. And then we know, Pakistan at a point was being used by violent extremist organizations who would come into Afghanistan, execute attacks, and flee back over the border. So again, this has strategic implications, even if we're using it tactically or operationally.
Excellent. Let's jump into the next one.
And then, the end of the decade, 2010, Haiti had a 300,000 deaths in an earthquake. It was amazing and devastating. And you can see here, again, the entire hillside's gone, the building's gone, electricity gone, and just trying to pull people and relatives out of the rubble. They lost everything. The only hospital left standing after the earth stopped shaking was, fittingly, an Argentinian field hospital that had been set up there just to help out overall in the country. So they just happened to be doing a rotation up there, and they were the only ones left standing. But that's not to say they were the only ones there, because very shortly thereafter, over 24 countries brought in some type of field hospital. China, Russia sent the medical presence to Haiti. Additionally, Israel and Qatar both sent field hospitals as well. So when you think of exporting global health engagement, you think about the big countries, but Israel and Qatar as well were contributors. So global health engagement is, again, it's an opportunity at times to cooperate, but it's also at times used as competition. In this case, though, definitely cooperation. Trying to get everything in, though, is could be a significant problem. The airport, there's only so much ramp space for aircraft on ground. Coming into harbors after earthquakes, oftentimes the channels are blocked because sand and rocks have shifted because of that. So sometimes it's difficult getting in. Just being offshore, having used aircraft to come in by helicopter because we can't put C-17s on the ground. That's sometimes how we need to get people in. Wow. But this was a great example that, again, at the close of that first decade, another example of really reactive global health engagement, but something that was positive, out of such devastation, at least we had something that, was positive that could come out of it.
Got it. All right. Let's move on to the next one. Oh, hold on. Here we go. And this looks like Africa.
It is, sir. But tongue in cheek here, it could be building outside the Fort Campbell gate potentially, right? So I think anyone who's been in the service for a while knows, there's some of those areas just outside the gate. We've got a little rusted roof there. We've got 55-gallon drum, maybe some boxes in the front yard. We've got some bars on the window. This looks like it could be outside the gates of Fort Campbell. But you do see an Army generator if you look close enough in the back there. Maybe putting some power into that building. Let's take a look at that next slide.
Okay, next one.
What that actually is, you can see the bars on the background. This is actually an Ebola lab. This is West Africa.
Wow.
Circa 2014, 2015, right?
That is awesome.
It is, right? That's the cool part about global health engagement. You can go anywhere and you can do, I don't want to say anything, right? But you can do pretty close to anything, given the right circumstances, the right equipment, and the right mindset. It's really a mindset too, right? So I talked earlier about how a lot of times we used to come in and we used to supplant the host nation facilities, and we would do something that was non-sustainable. Well, Operation United Assistance, as we came in to do that in 2014, 2015, there was really a cognizant effort with this operation to support other agencies and host nation agencies in getting after it. So as they took a look at what was in place already, it was really bolstering what was already there in West Africa, doing some training with our counterparts, our military medical counterparts, our civilian counterparts. U.S. State Department came in, and USAID had a huge role in this. As we come in and open the door with soft power and with global health, it also allows USAID, which is really an organization run by the State Department that looks at much more than just health. It looks at infrastructure, electricity, all those types of sustainment structures that are necessary to move a state from fragile to stable. So this had the opportunity here, Ebola, the outbreak, had an opportunity to just really devastate the continent of Africa, and not even the continent. It could have jumped, right? We saw things jump with COVID recently from China to the United States to Italy, and we saw the devastation that it could cause. So Ebola transmits, without getting too much into it, it's a lot harder to transmit Ebola than it is COVID, which was, it sort of gave us a leg up a little bit, but we wanted to make sure it didn't jump anywhere. So again, coming in, bolstering, doing education with our counterparts over there, and making sure that host nation facility was capable of taking care of those patients. Excellent. So, but this really isn't the only things we've been doing in Africa. The next slide actually shows the PEPFAR program, which is the
PEPFAR program. What is that all about?
So the PEPFAR program is the President's Emergency Program for AIDS Relief, and this has been in existence for quite some time. George Bush established it. Every president since has renewed it. And this slide really talks about their goals to hit 90-90-90, right? The goal is to make 90% of personnel aware of their HIV status, get 90% of those on HIV treatment, and get 90% of those virally suppressed. So, and this comes from the from the UN AIDS data last year. And by getting to 92%, 93%, 94%, the bottom line, what that means is 81% of all people living with HIV are aware and virally suppressed. So this disease that, we look back 30 years ago, 40 years ago, we didn't know what HIV or AIDS was. Mm-hmm. And I remember growing up watching A for Africa, right? And we had huge concerts, and we were trying to get funds together to try to help a lot of those countries over there deal with AIDS. And wow. PEPFAR is a State Department run program, so military can't really take credit for global health engagement, but it's another great example of global health engagement and how getting after things along those things that are important to citizens of those countries can help stabilize a country. So, for example, if I have AIDS and I'm living there in Kenya or some other country over there, and I'm not healthy, I'm going to miss work. If I'm missing work, I'm not getting paid. If I'm not getting paid, my family may not be eating. They may not, we don't know where we're living. Maybe it's easier for me to take $50 from someone to go shoot at U.S. soldiers or to go shoot at a government official. So as we circle back around to violent extremist organizations, which have really run rampant in the Sahel area, in the middle of Africa, in that belt of the steppes, really. Yeah. Mm-hmm. The ability to decrease the temptation to go work for something like that by being able to make people healthier and more dependable. They can go to work, they can hold down a job. All those are all intertwined. And the more and more you unravel that yarn, you can see that they're all connected.
Interesting.
Especially
interesting. Yeah. You were mentioning, when you improve one's quality of life, they tend to not get themselves involved in negative things. It's almost blatant. That could be applied to almost American life as well. So I don't want to go too deep into that as well. I do think it's interesting that we do take that route, and there is a rationale behind everything that we do. And there's secondary and tertiary effects of bad health could eventually lead down to desperation, and then joining negative organizations that could eventually create harm towards others. So it's just interesting, that point that you brought up.
No, you raise a good point. Violent extremist organizations, as we learned about in the War College, they can be anything. They can be mafia type organizations. They can be terrorist organizations. They can be gangs. So as you tie it back, and me growing up in New York, I grew up outside the city on Long Island, so I was not in the city. But those organizations can appeal to. There's a lot of similarities as you take a look at this. Military-aged males are a target for both recruiting, whether it be gangs or whether it be violent extremist organizations. And if you don't have a lot of options and you're worried about your family and you've got to put some food on the table, and there's a dearth of choices, it's a very difficult choice to make. So if we can help through global health by providing that, taking that one, I don't know how else to say it, take that rock out of the rucksack so you don't have to worry about carrying that rock around, right?
That extra weight, take that extra weight off. Yeah.
Try to take some of that weight off. So there's absolutely some similarities there.
Similar to you, I grew up in New York myself, Brooklyn, New York. And and so seeing, unfortunately, people that I grew up with who fell into the wrong crowd because of lack of opportunities that were presented to them or they were living in, it's just interesting how, things kind of work out, the irony of it all. But
without getting too far off the topic, when I tell people I was born in Jamaica, they look at me and they're like, what? When I say Jamaica, you think Jamaica, Queens, right? So, born right in, next county over. But if I tell people I was born in Jamaica, and I've tried very hard to get rid of the accent, it only comes back when I say water or coffee or something like that.
It's all good, sir. It's all good. Let's jump into the next slide.
All right. So some pictures here, just, some examples of global health engagement. And what you're looking at in the bottom left there is young Lieutenant Wissemann in Kosovo doing some exams and, taking a look in people's ears. This was back circa 2001, 2002. And there I am just off LSA Adder in probably April 2003, hanging out with some of the local kids, helping, provide some healthcare. And not just healthcare, but we were working with a school at that time. Trying to get the school up and running, because again, it's stabilizing that entire population, that entire area. And then on the right, that's Captain Jennifer Wissemann. She got out as a major a few years ago and pursued her DNP, so she's now a doctorate in nursing practice. But that's her over in Afghanistan. She deployed on about 72 hours notice to go to.
Oh, wow!
Yeah. With a 4-month-old she left behind while I was in company command, and we all made it work because that's what we do as military families. But this was a great opportunity, and she loved going there. You see her here teaching in a women's hospital there in the capital, trying to help build those relationships and empower women as well. When we talk about global health, that's a huge piece as well, making sure that women are empowered. So.
Excellent. And all opportunities that came through as military professionals, education, obviously the humanitarian work, I would say you a little bit of a poli-sci work as well. You kind of went in the governmental hearts and minds there as well. So I'll give you a shout out about that as well. But sir, these are just excellent things that you're speaking about. And, are you doing some research right now? I think I learned that you were doing some research and further studies and all that right now.
I am. I'm looking at, besides global health engagement, the next thing I'm sort of looking at is MDO, multi-domain operations, and the military medical effects, especially in an urban type environment, where those sort of changes will be, there's several things we'll have to change. As far as the way we do business when we start competing against a near peer. So from a medical perspective, right, our structures are a little bit, once they go on the ground, they're pretty difficult to move. So we've got to be able to move those structures a little bit faster. But I'm working on that right now with a partner out of U.S. Army War College, Lieutenant Colonel Brad Tibbetts, and he's working out of there too. So we're trying to stay tied in with the library over there and dig through a lot of research and papers. And there's a lot of good, as we sort of transform the military from what we've been doing, which was counterinsurgency, to more of a focus against whether it be China or Russia, there's huge and different implications. We've got to be able to move fast. Dr. Colonel, you had him on last week from the Futures Command.
Carter.
Oh, yeah, Dr. Carter. Colonel Carter had a fabulous presentation as he starts talking about AI and the way we can leverage that on the battlefield. In fact, on the Joint Trauma Call, which we do every Thursday, the Futures Command presented about AI evacuation platforms potentially in the future that may be able to treat casualties independently and autonomously. So, especially if we're talking about high intensity conflict, where we're talking about a large number of casualties that can fill up that battlefield very quickly, and the ability to get them off and getting to definitive care may be difficult.
Excellent.
But circling back to global health engagement a little bit, there's I think it was Lieutenant Colonel Michael Hamilton you had on.
Hamilton, right? Yes, Colonel Hamilton, West Pointer.
Yes,
solid. He is solid as a rock. Solid.
A great school. I was just not smart enough to get in. My niece went and she graduated, I think, 2 years ago. But coming out of there, Colonel Hamilton, great presentation. He talked about diversity. And when we talk about global health engagement, there's absolutely an opportunity to tie in the diversity that we have.
What's the tie-in? Can you talk to us about that?
Absolutely. Good example is normally we do a number of medical assistance programs or subject matter expert exchanges. We call them now med-recs, right? Medical readiness exercises.
Mm-hmm.
Where every summer we'll go to Africa. And last summer we were supposed to go 3 different countries. Well, as we planned, we turned them off because of COVID, which is going to have a huge impact potentially on GHE. But as we took a look at planning these, we tried to focus on who in our footprint may have relatives or may have come from that country, right? Because in the United States, we're a huge mixing pot. So, we've got people in our ranks that have that that ethical and cultural knowledge that we can leverage, right? It's not a weakness, not at all. This is our strength. This is a great opportunity. Whether it be something as simple as identifying who speaks the language. So when we go over there, we're a little bit more culturally aware, right? Most people will speak English when we get over there, and we've got translators we bring with us. But if someone can, in a military uniform or, from the U.S. side, can speak French to someone in Senegal, for example, right, and they can communicate there, it keeps us from looking like the ugly Americans. Because I remember you saying you were stationed in Germany, right?
Yeah.
Now, in K-Town, who speaks English?
The Americans do.
Yeah,
the Americans do speak English, but you've got to adapt to wherever you go to. But more than anything, having the soldier within your ranks that can actually assist you with, adjusting to the new neighborhood or the new culture that you're going to. That soldier could actually teach fellow soldiers on the left and right the nuances of that nation. So yeah, you could come over and speak the language. You could get a translator, but you may not know the little intricate nuances of being in that culture now that you're working. And that's something that, as Chief of Staff of the Army, General McConville said, diversity is our strength.
To echo that, I listened to a podcast from the Modern War Institute, MWI out of West Point, and they talk about urban warfare. And there was a gentleman on there who works for an organization that's just outside Fort Hamilton. And the organization really takes a look at urban terrain, urban fighting, and what would have to occur. And the name escapes me at this time. But one of the points he did raise was that if you take someone from New York and put them back in New York, they can, you can walk down the neighborhood in Brooklyn that you're from, and the power dynamics, right?
Oh, yeah.
Not just the police, it's not just the politicians, it's everyone out there. How's this work? How's that work? And being able to leverage that with our soldiers, that's huge, because when we go into name the country, if we have someone who originally came from that country or has relatives there, or who's visited there, or is at least in the neighborhood, they're going to have a far better understanding of those intricacies that we can't comprehend.
Correct.
So you're spot on, Otis.
Correct. I mean, we can use this discussion here and transfer it into general society as a whole right now. I mean, these are things that we celebrate. These are things that we acknowledge. And these are things that we're going to use to become the dominant force. Not dominant in the sense of imposing our will, but dominant in the sense of knowledge. Because with knowledge comes a whole lot of power that we will now have and adjust to. But sir, our discussion has been going great. Do you have anything, I guess, in parting that you want to share with us, celebrate with us? I mean, I've got a comment here regarding COVID-19. Are you able to answer COVID-19 questions? I think I'm going to hold off on that. I'll inbox you about that question. But do you have anything you want to share with us about, really what you do and what we're going to in regards to Army and the global health engagement?
I think, Otis, looking at that question over there, that's probably a little bit beyond my scope, in all honesty. I can tell you that the Army is really getting after it, though. And there's some great people out there. As a matter of fact, Dr. Fauci just engaged and did a grand rounds with a Facebook grand rounds. I
just shared that. I actually shared that on my battalion page. So I'll send this young lady the information about that.
Yeah, and obviously with things changing, what was true, as we understand it, was true right now, may be different, 2 weeks from now. And what we knew as true and factual in March, it, again, is changed to today, because as we learn and we work our way through the scientific process of course, from that part, from a clinical perspective. We're learning more and more about the disease every day. We're getting better and better testing. We're getting more and more fidelity with numbers. So again, there's a lot going on right now, and it's not that as a matter of fact, the small group I was in at the War College, I was the assistant group leader. The primary group leader was Colonel Stu Tyner, and he was, until very recently, the chief of staff at RARE, which is the Walter Reed Army Institute of Research.
Wow.
When we talk about global health engagement, Walter Reed, name recognition, if you don't know, Walter Reed did a lot of work with malaria, right? Especially building the Panama Canal Zone and working through there. And they named this institute after him, the Walter Reed Army Institute of Research. And until very recently, he was the chief of staff there. And now I believe Stu moved over to infectious disease and runs sort of that department. But you can imagine how busy they are right now. Neck deep in the COVID, trying to help find solutions, better fidelity for some of the testing as well. And they do phenomenal stuff there. And in fact, a lot of that translates over to global health engagement too, because they've got a host of facilities across the entire globe. We've got facilities in Kenya. We've got facilities in Tbilisi in Georgia. We've got facilities in Peru. And well, the Army doesn't necessarily have them in Peru, but between the Navy, the Air Force, and Walter Reed.
Us, as in military, period.
Oh, yeah, absolutely. And a lot of these facilities they're partnered with the Ministry of Health on a national level. They're looked at as crown jewels in the local healthcare system. And the partnerships that are created there, there's a military component to it, but most of the people in there are civilians, local civilians from that country, and we bring them in. And we help them work through PhD programs back in the U.S. So we've got that connection. They're doing bench work. They're doing scientific work. And because they're part of that nation, again, building those relationships, building those bonds, and being able to I hate using that word leverage, but being able to depend on those relationships when we need them. And bolstering that host nation facility, because those guys can leave the lab and they can go work for the Ministry of Health, or they can go work for this company or that company. So even, Walter Reed's got a huge impact on global health as well. Even if they're just, I almost said just a stateside organization. They're not a stateside organization. They're worldwide.
Excellent. So I mean, in closing, what I think I'm going to ask anyone that's my guest moving forward these types of questions. So say, for instance, we're in an elevator and you've got to give your 15-second spiel on what exactly the global health engagement is all about. Can you tell it to us, just in case those people at the end just need a simple summary of essentially what the program is all about? Can you give that to us?
Sure. Global health engagement is using health to help influence the world and try to make it a little bit more stable and a better place to live overall. That's really what global health engagement is, to try to set the lead using soft power so people aspire to be a little bit more like the United States.
Excellent. So, sir, I really appreciate our conversation today. If you could hang out in the broadcast room, let's talk a little bit. I'd really appreciate it. And, obviously, you're welcome to come back again, bring some guests with you, and let's talk about what good things that we're doing out there in regards to, Army and global health, and essentially just taking care of people, whether it be locally or internationally.
Well, thanks for having me, and I hope it resonated a little bit with your audience. So thanks.
All right, sir.
All right.
And so we had a great conversation today with Colonel Wissemann in regards to global health engagement. Just the wonderful opportunities that are there. If you want to join the military and possibly work in a humanitarian effort, the opportunity is there. If you want to learn more about exactly the influence and the opportunities to help those that do need that help out there, it's out there. So, we are not just a run around and fighting wars types organization, but we're an organization that actually assists and take care of those individuals that may be in our current nation or internationally as well. So, and it kind of resonates, I guess, with my parting team that I always say: take care of yourself, take care of your family, and take care of others. Bye now.